Great. Well, good morning, everyone, and welcome to our final Global Health Tuesday webinar of this academic year, entitled Climate Change Impacts on Global Health. Thank you for joining us. My name is Calyn Ostrowski, and I am the Associate Director of Strategic Partnerships and Development here at the Global Health Institute. Today's session is part of our monthly Global Health Tuesday webinar series, featuring researchers and practitioners from the University of Wisconsin-Madison and around the world. Our webinar series highlights and discusses the complexity of global health challenges and the many kinds of expertise needed to address them. At UW-Madison, our foundation starts with the Wisconsin idea, a practice which takes knowledge and research out of the classroom and into real-world settings. Climate change presents a significant and multifaceted threat to global health, requiring coordinated efforts across sectors to mitigate its impact and protect vulnerable populations. Today's discussion will explore opportunities to enhance health outcomes by tackling climate change. But before I introduce our moderator and speakers, a couple of quick housekeeping items. First, we are recording today's session, and the archived video will be available on our website. And we are monitoring the chat, so please share your questions and comments for the panelists there. So with that, let's get started. Today, I am honored to welcome Ambassador John Lange as our moderator. Ambassador Lange is the Senior Fellow for Global Health Diplomacy at the United Nations Foundation and serves as the Foundation's primary focal point for global health diplomacy activities and its wide-ranging work with the WHO. He chairs the leadership team of the Measles and Rubella Initiative and earlier served as co-chair of the Global Polio Eradication Initiative's partner group. Lange has a distinguished 28-year career in the Foreign Service at the U.S. Department of State, where he was pioneer in the field of global health diplomacy, serving as the Special Representative on Avian and Pandemic Influenza, Deputy Inspector General, and Deputy U.S. Global AIDS Coordinator at the inception of President's Emergency Plan for AIDS Relief, and U.S. Ambassador to Botswana. Lange also worked at the Bill and Melinda Gates Foundation, where he engaged in high-level global health advocacy with international organizations and the African governments. John is a UW-Madison alum and serves on many boards at UW-Madison, including here at the Global Health Institute. Welcome, and thank you very much for your leadership, John. GHI also welcomes Sumudu Atapattu. Sumudu is a teaching professor and director of the Global Legal Studies Center at the University of Wisconsin Law School. She is affiliated with UW-Madison's Nelson Institute for Environmental Studies, the Center for South Asia, 4W Initiative, and is on our advisory committee here at GHI. Sumudu is also the executive director of the Human Rights Program. Sumudu serves as lead counsel for human rights at the Center for International Sustainable Development Law, and is also on the affiliated faculty at Raoul Wallenberg Institute for Human Rights in Sweden. She has attended and provided expertise at several UN Conference of the Parties, or COP, discussions, and her research examines the link between human rights and the environment, especially climate change, climate mitigation, and small island states. Welcome, and thank you for joining us, Sumudu. We also are pleased to welcome Dominique Brossard. Dominique is a professor and chair in the Department of Life Sciences Communication here at UW-Madison, an affiliate of several UW-Madison units, including the Robert and Jean Holtz Center for Science and Technology Studies, the Energy Institute, the Nelson Institute for Environmental Studies, and is a member of our advisory committee here at the Global Health Institute. She is a PI at the Mortgage Institute for Research and co-directs the Science, Media, and Public Research Group. Dominique is a fellow of the American Association for the Advancement of Science and of the International Communication Association. Dominique is an internationally known expert in public opinion dynamics related to controversial scientific issues and has been an expert panelist for the National Academy of Sciences, Engineering, and Medicine on various occasions. Welcome, and thank you for joining us, Dominique. And last but not least is Jonathan Patz. Jonathan is a familiar and friendly face to GHI, having served as my boss and GHI's first director from 2011 to 2022. Jonathan is the UW-Madison Vilas Distinguished Achievement Professor and the John P. Holton Chair of Health and the Environment with appointments in the Nelson Institute for Environmental Studies and the Department for Population Health Sciences. For over 15 years, Jonathan served as lead author for the United Nations Intergovernmental Panel on Climate Change. He has co-chaired the Health Expert Panel of the U.S. National Assessment on Climate Change, a report that was mandated by U.S. Congress. He is an elected member of the National Academy of Medicine and has been invited to brief both houses of Congress, as well as serving on several scientific committees at the National Academy of Sciences. Welcome to all of our many esteemed panelists, and I will now hand the discussion over to Ambassador Lange to get the full discussion started. Thank you.
Thanks very much, Calyn, and thanks also to Jorge Osorio and Katie Newcomb for organizing today's webinar on a topic that you will be hearing more and more about in the coming years and decades, the impact of climate change on global health. The climate crisis is a health crisis. Climate change negatively impacts human health as life-threatening temperatures are becoming more frequent. The transmission of deadly infectious diseases is rising due to increased climatic suitability for vectors, and weather extremities are causing food and shelter insecurity for millions of people. Approximately half of the world's children live in countries that are rated high risk for exposure to the impacts of climate change. To get a better sense of what this entails and what it really means on the ground, I'd like to go into detail on one particular concern, and that is a deadly vector-borne disease, malaria. According to the World Malaria Report, there were nearly 250 million cases of malaria in 2022, with over 600,000 estimated deaths. According to a Georgetown University study that was published in February of last year, warming temperatures are allowing malaria-carrying mosquitoes to invade new regions and reach higher altitudes. Using data from the last 120 years, researchers found that Anopheles mosquito populations in sub-Saharan Africa gained an average of 21 feet of elevation per year and expanded their habitats south of the equator by nearly 3 miles per year. That pace tracks with the historical effects of climate change and could help explain how malaria's reach has expanded in recent years. The data appear to reinforce scientists' fears about how climate change will fuel the spread of infectious diseases. And it's not just malaria, it includes dengue, chikungunya, Zika, Japanese encephalitis, and West Nile viruses by expanding the habitats of various common zoonotic disease-carrying vectors. That's a very specific example, but it shows you what's happening out there. And with that example in mind, I'm pleased to report that nations of the world have clearly recognized the connection between climate change and health. Next week, the annual World Health Assembly will convene in Geneva, and they will consider a resolution on climate change and health. And also, you're all familiar with the United Nations Framework Convention on Climate Change, which has nearly universal membership, 198 states parties, and it's the parent treaty of the 2015 Paris Agreement. As you know, the aim of the Paris Agreement is to substantially reduce global greenhouse gas emissions to hold the global temperature increase to well below 2 degrees Celsius above pre-industrial levels. The UN Climate Change Secretariat organizes the annual Conference of the Parties, and much has been said about COP28 that took place at the end of November and early December of last year in Dubai. For those of us who are interested in global health, a milestone was reached at that event when the COP28 presidency, the United Arab Emirates, in collaboration with the World Health Organization and other partners, hosted the first ever COP Health Day, which lifted the political profile of the climate health nexus and contributed to mainstreaming health in the global climate change agenda. For the first time, health ministers attended the conference alongside their peers from environment ministries. That Health Day saw $1 billion of funding committed to both mitigation and adaptation programs. It also culminated in a new declaration on climate and health signed by over 120 countries. The declaration was developed with the support of a number of country champions, including the United States of America. The declaration covers a range of action areas at the nexus of climate and health, including building more climate-resistant health systems, strengthening cross-sectoral collaboration to reduce emissions and maximize the health benefits of climate action, and increasing finance for climate and health solutions. Signatories also committed to incorporate health targets in their national climate change plans and improve international collaboration to address the health risks of climate change. Today at this Global Health Institute webinar, we're really fortunate to have three distinguished speakers on this subject, and two of them attended COP28 in Dubai. We'll start the discussion with a focus on the climate health nexus, then shift to climate change, health, and human rights, and end with climate change, health, and communications. There will be time for questions after all of them have spoken. So first, as the moderator, I'd like to call on Professor Jonathan Patz, who is just back from Melbourne by way of Berlin, and I'm pleased to say is awake despite his jet lag. So please, go ahead, Jonathan.
Okay, let me share my screen here. John, that was a fabulous introduction and very, very insightful, and you hit on a lot of key issues. And I'll just say that, you know, to me, there are three narratives of the climate crisis. One is vulnerability and risk, which you outlined quite well. The other is equity. And the third one, which is the title of my talk, is a message of hope and climate action. And so I'm going to be focusing on how the actions that we do to reduce greenhouse gas emissions could have enormous health benefits. And most of you on this Zoom already know the story of climate change. You know, burning fossil fuels and these greenhouse gases are heating up the planet, and you've got rising temperatures, sea level rise, and extremes of the water cycle that lead to these health impacts, that some of which John just alluded to. And I've dedicated multiple decades of my career on looking at the risk and how there are so many pathways through which climate affects our health, that now I am focusing on the, interventions. What do we do? And we can, at this level, we can have, reduce the risk and build resilience and have adaptation. And at this level, we can go to primary prevention upstream and reduce emissions and go to the source of the problem. So I think we, as far as a global health approach, we need both approaches to reduce the risk, and knowing that climate inertia is that we are going to be seeing extremes. We already are extreme weather events. And so we need to build sustainable, resilient communities and act at that level. But I also think that you can't just be mopping up the floor without thinking about turning off the faucet, and to go upstream and through major policies across sectors, especially energy, transportation, and agriculture, to reduce greenhouse gas emissions and get to the root of the problem. Now, of course, we need to build a political will and public awareness to get these policies moving. And so I'm so glad that we've got, I'm joined by Sumudu and Dominique to look at both climate justice, but also better communication to get these policies in place. Now, if you think that this is a very comprehensive look at the problem, I agree with you, because this is the entire structure of our second edition textbook that just came out. And I'm pleased to say that at the end of my sabbatical, which is nearing the end, we have released this book. So you can go to the book and look at all these other things. But for the rest of the talk, I'm purely going to talk about mitigation and reducing emissions, less burning of fossil fuels as a golden opportunity for public health. Certainly we know that air pollution is dangerous. And the latest report that came out of the British Medical Journal, published last fall, is that 8.7 million people die prematurely every year from air pollution. Of that 8 million, over 5 million premature deaths are directly tied to burning fossil fuels. The food sector, a golden opportunity here, huge benefits if we can get to a universal healthy reference diet, which is a diet that most of us know about, very little or no red meat and lots of fruits and vegetables. I'm really not going to, for the sake of time, I'm not going to dive into this, but this is a main report out of the Lancet Commission that showed that if the world followed this universal healthy reference diet, that could eliminate 11 million premature deaths every year, a huge benefit. And finally, transportation sector, because of our over-reliance on motorized vehicles, there's sedentary lifestyles. People, at the population level do not have an opportunity to build in exercise to their daily routine. And so we're talking about another 4 million premature deaths that could be avoided. So that adds up to about 20 million premature deaths that could be avoided by getting to a low carbon economy. My own group has been looking at this in the United States. If we could decarbonize across sectors, the reduction in fine particulates, PM 2.5, that's one of the most harmful air pollutants, would be reduced such that decarbonizing in the US would save over 50,000 lives every year and billions of dollars saved in avoided mortality, hospitalization, and lost workdays. In the transportation sector, US cities with the highest rates of walking and cycling, what we call active travel, have lower obesity and diabetes rates. And also contracting muscles, you're not just burning calories, contracting muscles are chemical factories for anti-cardiovascular and cancer chemicals. So exercise reduces heart disease, cancer, dementia, and depression. So we know this, but we really need to be designing this way and really prioritize. And in the design, it's got to be equitable, and infrastructure, improvement in infrastructure also needs to be coupled with community education programs. And we have to go beyond designing for middle-aged men in Lycra, what we call mammals. Finally, I just want to say that with the Inflation Reduction Act, the Biden administration is providing over $370 billion in incentives in reducing greenhouse gas emissions over the next 10 years. This is the largest climate change legislation in history. And regarding relevance to health, both the IRA and the Infrastructure Investment and Jobs Act can have huge benefits. Here are some examples, looking at policies for zero emission fleets and reducing air pollution at ports of entry, appropriation for construction of renewable energy, efficient buildings, and looking at air quality monitoring in underserved populations and at schools. So there are a wealth of policies built into this large legislation that have direct health benefits. And it's really something to be proud of. And I'll just end by two pictures here. This is a picture of Copenhagen in the 1960s. And here's a picture of the exact same picture years later. And it's to show that smart policies make a difference. And these things don't happen by accident. And so we really need to lean in for systems change to really push for some of these policies that are beneficial for human health and well-being. And so with that, I thank you for your attention. I will now pass the baton or hand it back to you, John.
Thanks very much. That's really an excellent look at this, although I hadn't heard the term mammals before. And I don't wear Lycra. We'll get to questions for you later. At this point, we'd like to hear from the UW professor Sumudu Atapattu. Sumudu, please go ahead.
Thank you so much, John, and thank you to the Global Health Institute for inviting me here. Oh, what happened to my slides? Seems to have disappeared. Okay, let me pull up my slides again. Sorry about this. So I'm going to talk about the human rights aspects of climate change, especially the link with human rights, the global with health. Give me just a minute to pull this up. Okay. Of course, technology always.
And Sumudu, I'm here to help.
Yes.
I'm here to help if you need me to do it.
Okay, great. I think that might be the best.
Sure, just let me know.
Yeah, let's start the slides.
Great.
Yeah.
All right, can you see that?
Yep.
Wonderful.
Great. Thank you so much. So let's get to the next slide. Yeah, as I said, I'm going to talk about climate change and health and a human rights approach. So we heard a lot about the health impacts of climate change. So this chart shows some of the health impacts. One of the issues that we need to think about is that climate change is going to give rise to forced migration as well. People will be forced to move from where they are, whether it's within their own country, within their own community, or across borders. So that also gives rise to health impacts because many of these people live in appalling conditions. As we know, migration is a huge issue. So that's another area of climate impacts that we need to take into consideration when we are talking about climate change and health. The Intergovernmental Panel on Climate Change that both Jonathan and John mentioned, and of course Jonathan is on the IPCC, highlighted that the major health impacts of human-induced climate change will include disease and even death, as we saw, because of these more intense heat waves and fires, as well as undernutrition as a result of diminished food production as well. Air pollution, waterborne diseases, as well as malnutrition and things like that. And John mentioned malaria, dengue, and these vector-borne diseases. These are all going to increase as a result of climate change. And as I mentioned, forced migration as well as conflict associated with lack of resources, etc., will also give rise to health implications, and with that, impact on human rights as well. Next slide, please. Again, another snapshot of the impacts of climate change. Health is not the only impact, obviously. And then there are interventions and strategies that we have put in place, starting from the individual level all the way up to the global level. John mentioned the COP meetings. That's the Conference of Parties that meet every year to talk about the progress or lack of it. And of course, there's a lot of pushback from developing countries that not enough action has been taken. But as John pointed out, the first ever meeting on climate change and health was held at COP28. And I will talk a little bit about the resolution, the declaration that was adopted as well. Next slide, please. So health is a human right. Some of you may have heard about the International Covenant on Economic, Social, and Cultural Rights, which highlights that health, the enjoyment of the highest attainable standard of physical and mental health, is a human right. So, and then it does refer to Article 12, does refer to the improvement of all aspects of environmental and industrial hygiene. The Constitution of the World Health Organization also refers to health as a human right and without distinction of race, religion, political belief, economic or social condition. So everybody has the right to health, right? And there are two Sustainable Development Goals that are directly relevant. Sustainable Development Goal 3 again refers to health. And then goal 13 refers to climate action. So together, and of course, there are many other sustainable development goals that are relevant, but these are specifically on health as well as on climate change. Next slide, please. So the Office of the High Commissioner for Human Rights did an analytical study on the link between climate change and human rights and health in 2016. And one of the things that were highlighted in this report was that climate change will cause a disproportionate impact on certain segments of the population. And we know this already, and this goes to the health impacts as well. So, and it highlighted that a rights-based approach to health and climate action requires including human rights in policies and programs and be guided by international human rights law, principles and standards when these policies and programs are designed. And it also talked about identifying rights holders, which means us, the citizens, and ensuring that they participate in the decision-making process and providing access to due process as well as remedies if their rights are violated. And the report highlighted that this approach should be integrated in both adaptation and mitigation measures. As well, we saw that climate justice requires a rights-based approach to climate action based on principles of equity, accountability, equality, inclusiveness, and solidarity. Jonathan mentioned climate justice. So we need to ensure that these segments of population that are disproportionately affected by climate change are given attention and specific programs are put in place to ensure that they are not further marginalized by climate change and by the programs that we put in place as well. Next slide, please. So the first ever Health Day at COP28, this was the declaration that was adopted. So again, highlighted the fact that climate change has widened inequities and vulnerabilities both within countries and within communities. But unfortunately, the declaration does not refer to health as a human right. Human rights is not mentioned in the declaration. The next slide, please. So before I wrap up, I wanted to highlight a couple of cases that have been decided at the international level. One is Sachi versus Argentina. There were 16 children who brought petitions against their countries: Argentina, Brazil, France, Germany, and Turkey. They argued that they violated the UN Convention on the Rights of the Child by not taking sufficient action to cut down greenhouse gas emissions. And they especially argued that their right to health was violated by state inaction. And one petitioner especially highlighted the fact that she was repeatedly hospitalized for asthma attacks triggered by rising temperatures and exacerbated smog in her country. And the committee found that the youth are victims of foreseeable threats to their right to life, health, and culture. And this other case against Tetiora versus New Zealand, the Human Rights Committee recognized that a life with dignity would become incompatible when some of these countries, small island states, could become submerged in the next 10 to 15 years' time. Next slide, please. So to conclude, as we saw, climate change poses a serious risk to right to health, and states are required to take the impact of climate change on health in their mitigation and adaptation actions. And the Office of the High Commissioner's report highlighted that the negative impacts of climate change are disproportionately felt by these segments of the population that are already vulnerable or marginalized. These include poor women, women, children, migrants, persons with disabilities, minorities, and indigenous peoples. And also highlighted that states have an affirmative obligation to take measures to mitigate climate change and to prevent negative human rights impacts, and also to regulate the private sector to mitigate its contribution to climate change and to respect human rights as well. So I will stop there. Thank you so much.
Thank you very much, Sumudu, and that look at the human rights aspect of climate change and health is something that needs more emphasis in the global discussions. I think I commend you for bringing all this up. Now we'd like to talk about communications, so I'll turn it over to Professor Dominique Brossard.
Thank you, John, and thank you to the Global Health Institute. It's always a pleasure for me to interact with these distinguished guests, particularly my long-term collaborator, John, here. Nice to see you again, John. And indeed, I will be talking about communication and health and climate change. But I think what's interesting to see is how these talks, like by miracle, work very well, because I will be literally closing the loop and come back to something that John said as the opening of his talk, which is we do need to have policy, we do need to have stories of hope, and we need to tell people what they can do to actually help make this situation more, addressable and not letting them to go to despair. And so to go back to, and to some extent, to what Sumudu was saying when she was talking about international studies and John pointing to Sweden as an example of successful policy that have changed on the ground, I'd like us to go back to United States and just show that the complexity of taking action is really, I think, particularly interesting to point out when we look at the disparity of United States as certainly a country, but I would claim more like a conglomerate of little countries with each state having their own policy, their own attitude to climate change and so on. So although in the United States, I mean, the good news is now a vast percentage of adults think that climate change and global warming is happening, 72% in 2023, based on data by the Yale Climate Change Communication Group. You can see that there is some these differences across states. And so definitely something that's not homogeneous. And more particularly, what's important to keep in mind is that although Americans know that climate change is happening, when you think about the question of is global warming harming people in the United States, well, then health, you can see where I'm going. This goes down to 61%, so already lower. And more importantly, something that was being, mentioned very often across the United States, but has still not been addressed by policymakers. Within America, there's literally 6 Americas, from those that are alarmed, concerned, and even cautious, which means that they already will support policies to do something. You have, on the other hand, groups such as the disengaged, the doubtful, and more particularly the dismissive that really don't want to address climate change. So the issue is, how do we gather public support by policy? And I would argue the way to do that is really to work at the local level by really understanding what are people's concerns and attitude related to this issue. So Americans differ on their levels of concern. So this would be the same across the group, even in Argentina. To look at the specific example, you take the north of Argentina versus the south. One is close to the Amazonia and the other one is close to Antarctica. You can imagine that attitudes there vary as well. So we really need to work at the local level. Number two, so local level. Number two, we know by decades of research, and particularly myself and others, that we don't change attitude toward climate change or any type of issue that has not only science, but also ethics, legal, social implications, as Sumudu has pointed out. Explaining the science won't change attitudes. And why is that? Is because while people may understand the science, what really makes them inform their attitude is the mental shortcuts that they use to make sense of the world around them. So this is why, let's say, if we have a snowy season in Wisconsin, people are like, well, look at that. We do have a snowy season. Climate change is not happening. I mean, human beings, you and I included, esteemed audience, other guests, we do that all the time, because to think through everything around us just based on, looking at what scientists say and so on is not something that would be literally feasible in the context of our daily life. So basically, you see where I'm going. We need to work at the local level. We need to gather public support. We need to choose a communication frame that resonates with audience locally and use communication research insights. So the good news is people care about their health and their families. That's literally when you go at the community level and you don't frame questions in terms of climate change, but you frame them in terms of resilience and health, you have public support. The second good news is people trust their physicians and their health providers. And those, as a matter of fact, interestingly enough, in the United States, when we have a decline in institutions in general, even in medical doctors, unfortunately, they're still among the more trusted, providers and, let's say, institutions that people interact with in the daily life. So by targeting audience locally and using health as an entry point, we have a way to actually change people's mind and gather support for policy. And here I'm going to point out to some work we did with Jonathan in climate change. In 2020, we published a report on climate change is harming health in Wisconsin by using case studies of things that happen in Wisconsin: extreme heat, flooding, ticks and mosquitoes, but also pointing, as John was saying, the stories of hope about what can we do, because just highlighting risk most likely will not turn people into, like the concerned citizen that we want to, at the end of the day, vote for the policymakers that will enforce policy that make a difference. So this is one way to do it. And by the way, this report was interesting in the sense that we actually included testimony of people on the ground, school teachers that were talking about how in the summer they cannot teach because heat and so on and so forth. The second example I want to highlight is that some work I've done with the American Association for the Advancement of Science around the United States and you know, literally finding examples of what communities are doing with scientists at the local level to take action on climate change. Because very often what we do in our work in community engagement is communities want to do something, but they're like, how do we start? Can you give me an example of what we do? So I think this is really a lesson for us scientists. We need to go on the ground, be involved in our community, help them figure out the actions and the policy that will make a difference. We're doing that in Beloit in Wisconsin right now to do that. And last but not least, we need to listen to people's concerns. This is an example of a few years ago when I'm sure you know everyone who's that person on the left who was lecturing Americans about climate change is real and is happening right now. Not helpful. On the right, Arnold Schwarzenegger in California that says, I don't give a if we agree about it, but we agree it's you know, hurting our community, pollution is giving asthma and so on and so forth. Looking at solutions is the key to all that. So in sum, when talking about climate change and health, you know, we actually need to know the audience at the local level. What are their values, their motivation, understand their beliefs and building on those to build, you know, stories. And the good news is stories of health could work because frames matter. So, you know, talking about climate change, for example, in Wisconsin does not resonate. We don't use that word. We may use health and, you know, and so on, but certainly be careful. Trust matters, but we cannot take it for granted. And I think a lot of us, we think that based on our expertise, we can go in communities and talk to opinion leaders, but it may backfire. So we need to be very careful to actually choose allies that actually are trusted at the local level and can work with us. Finally, we need to take into account the psychology of risk perception. There's a lot to do in that area. That's personally the classes I teach at UW-Madison. And you know that thinking that everyone will react the same way to our message can backfire. So in sum, the problem is not the science in itself, because we know the science, but the way the science is described. We need to tell relevant stories, and actually stories about health impact of climate change at the local level with examples of solution will be the way to go. Thank you very much. I'm looking forward to the discussion. Baton back to you, John.
Thank you very much, Dominique. That was very insightful in terms of the ways to approach this to actually be able to convince people. I'd like to dig deeper on this and hear from each of you on this, taking the liberty of asking the first question. And please, others, submit your questions in the chat. This is very tricky. We don't know who's going to be the president of the United States in January of next year. We all know the politics of this, and there are some people, as was pointed out, are dismissive of the concept of climate change. Others are very alarmed, and that's a very interesting spectrum of this that we heard from Dominique about. And there are these human rights issues out there, but to me, it's hard to imagine some U.S. courts really applying some of these attitudes, and it really being specific in terms of the impact that could of a legal system on those who are polluters and those who are doing things that do not deal with the human rights and justice aspects of climate change. And meanwhile, we have, as Jonathan pointed out, all of these very specific issues that have come up, and we're not able, all of us who are part of this are not able to move to Copenhagen, so we have to deal with these things where we are. So when you look at this through a political lens, how can we really push this? Dominique dealt a lot with this, but I'd like to explore it further with all of you. I had a talk recently with a person from the Department of Defense who thought that the best way for climate change to be treated with the seriousness that it deserves, and that to really generate climate action throughout the political spectrum in the United States, was to focus on the health aspects. That's one of the big concerns that as we heard, everyone cares about their own health and their family's health. But at the same time, I can get pessimistic when I just look at what's happening in Geneva as we speak in terms of the potential pandemic treaty. Here you had a COVID-19, which killed something like 7 million people around the world, affected every individual on the planet. And one would think that the nations of the world would get together and come up with a much better system to prevent and respond to future pandemics. And the negotiations have been going on for 2.5 years. There's an international negotiating body that is supposed to deliver its report to the World Health Assembly for consideration next week for some type of pandemic accord, and that would involve things such as the concept of One Health, how the animal health, human health, and the environment are linked. So there are climate change aspects to this. And yet they have not yet come to an agreement, and probably won't by next week after 2.5 years of negotiations. And as I said, after having seen the severity of a pandemic causing millions of deaths. If that isn't the wake-up call, what else can be the wake-up call for governments? So I'm sorry to sound a little rambling here, but I just think it'd be useful to hear from each of you how you really see us able to make these specific changes given the national and international political landscape. Let's go in order with Jonathan.
Sure. Yeah, John, great question. And I have 3 things to say. Number one, and it may be my bias because I'm in the health field, I think there's much more common ground around the health issue than environmental issues. So I think number one, that highlighting that the climate crisis is a health crisis is a good start and can bring in more, of the middle, the moderates. Or secondly, I think that it's really important to convey not only urgency, but hope, and give agency to understand that there are things to do. Because if we're pessimistic and game over, well, no one will do anything. So number one, we really need to highlight the opportunities and the potential for solving the problem. And then the third one, which is more of a handoff to Dominique when she jumps on, is that we really do need to take on the disinformation campaigns. I remember when WHO said they were more worried about the infodemic than the pandemic. We have the same problem, and I think this is where we really need to bring in communication scientists at a higher level to really get serious about fighting the disinformation campaign.
Thank you. That's very helpful. And Jonathan, I have to say, I've always admired your ability through TED Talks and many other fora to present hope and optimism in this, of yes, we can do this. And I really think that's a very important aspect to this. Let's now go to Sumudu, please.
Sure. So one of the things I have been grappling with, and this goes to what Dominique said as well, how do we sort of convey the severity of the problem to the people and the urgent need to take action? So a lot of people, when we talk about climate change, get overwhelmed by the magnitude of the problem. So I think it's very important, and this goes to the work that people like Dominique are doing. How do we sort of make this into bite-sized, sort of manageable issues so that people can understand, people can wrap their head around this. Because if you look at, basically everything, every sector of the economy is contributing to climate change. So how do we get that message across without overwhelming people? And secondly, unfortunately, both COVID and climate change have been politicized, which is very unfortunate because, as you pointed out, it's a health issue. And also, I think it's important for us to highlight the economic aspect of climate change. I don't think enough has been done to emphasize the economic aspect of climate change, because ultimately this boils down to dollars and cents, right? Last year alone, there have been over $1 billion climate-related disasters just in the US every 2 weeks on average. Over $1 billion disasters every 2 weeks. Just imagine the impact on the economy. And this is just in the US alone. And not taking into account the human aspect. This is just the economic aspect. So understanding, and I think in addition to health, I think we need to pay attention to the economic aspect. And California, some insurance companies in California are refusing to insure houses for damage caused by wildfires, right? So, this trend is only going to get worse. So how do we get this message across? I think looking at climate change from every aspect, health is one, but economics, the security aspect, equity and human rights, all those aspects, I think, should be taken into account. I will stop there. Spoke too much.
No, very good. Thank you, Sumudu. And I like your idea of the bite-sized manageable issues. The Washington Post recently had an article about the number of inches of sea level rise along the Gulf Coast and the Atlantic coast, and it's those kinds of specifics that may be able to convince people. Dominique, please go ahead.
Yeah, thank you. I think my two colleagues here were both completely on point, and I'm concerned they're gonna get my communication job soon. So basically, as Sumudu was saying, I mean, I totally agree with John that actually a health frame resonates with people for the reason I mentioned, right? People care about their health. And this is something where that's less controversial than the environmental sector. Unfortunately, for the environmental sector, environmentalism in the United States, particularly and across the world, now is equated with progressive left views, which is not conducive to finding bipartisan solutions to issues, right? We want to step out of the politicization of this issue, and I agree with Sumudu that the COVID has become politicized. Interestingly enough, in March 2020, I was interviewed by one journalist, and he asked me, what do you think is something that's really concerned about COVID right now? I'm like, let's hope it doesn't become politicized like climate change. Here we go. So I guess I was not, anyway, so that was really unfortunate. So let's build, shared bipartisan approaches to solution. And, global policy will happen if local policy are desired. So policymakers are elected and end up going to negotiate in the global scale if they are elected, first of all, at the local level, and then, going up the scale. So you have to go and work from both sides. So this is important. So you need to have public support at the local level for global support for, compromising solutions happen. And, by the way, I work on controversial science. So I was in Germany talking about CRISPR-Cas9 human gene editing. Why can't we have some global, accord on this issue as well? So it's not only climate change, it's any science issue now is deployed globally. Artificial intelligence, another one where that's also a risky one that we need to control at the global level. So this is not the first time we are, facing this kind of complex issue that needs some support globally, but I would argue that it starts with building support locally. Second, And I think that build on what Sumudu was saying, yes, health is great as a communication frame, but it's not always the one that will resonate with people. If I'm super healthy, I'm 20, I'm a male that's leaning Republican, I may not care about health. I will care about the economy. I will care about finding jobs. I will care about my community, be resilient, and so on. And the economic frame for climate change in our research has been proved to be also very effective. Again, it depends of who you're talking to. It depends of the audience. If you talk to some business leader, we need to use the economic frame. And as a matter of fact, countless organizations and corporations in the United States are investing in renewable. Yes, certainly it's because of the Inflation Reduction Act and potentially money there, but it's also because it's good for their business. They realize at the end of the day, it pays off. Going back to the Wisconsin example, we're working with, northern Wisconsin that is built on, income with tourism and recreation, with less snow, less snowmobiles, less cross-country skiing. It hurts the economy and so on and so forth. These are things that resonate with people, right? Like the economic impacts will resonate with people as well. Third, so local, choose the right frame, economic or health and whatever. And last but not least, hope sells much better than doom. If we need to remember something, and this again and again, stories of persuasion will tell you, you bring people on the bandwagon, we show them they can do something. We need to actually show examples of communities that have successfully worked on the health of the community, economy, and whatever, to actually show how, yes, we can. I mean, there's a reason why Obama was elected at the end under this slogan. Yes, we can. People are, yeah, we can. So let's remember that we sell, doom doesn't sell. Like, you're not going to bring people, into like action just by telling them that horrible things will happen. As a matter of fact, in persuasion, we know that the more you try to scare people, the more they may take to hide and avoid the issue.
Thank you very much, Dominique, and I really like that idea that global policy will happen if local policy is desired. Appreciate that very much. We don't have a lot of time left, but I do want to get to the audience. So, Calyn, if you could please ask questions from the audience.
Great. Yes. Thank you, everyone. There has been a few questions in the chat. One earlier to Sumudu was in the context of addressing health as a human right. Can you talk about what this means in the for-profit context, specifically in the medical care system?
Yeah, especially in this country, it's very hard to talk about health as a human right. But I come from Sri Lanka, where we have a free healthcare system. And, there are certain things that the government should provide. Of course, emergency care is one of them, but, preventive health, ensuring that, health is incorporated into policies and getting policies and programs and getting people's participation in those policies and programs, ensuring that they have a voice in these policies and programs because it's for their benefit, right? And also providing funding for these programs is very important, right? So we have a very different healthcare system in this country, but if we sort of think that health as a human right, consider health as a human right, then our mindset will change. So, I mean, I hate to say we need to get rid of the insurance companies, but it's a way, at least have a dual system where, we do have certain programs for people who cannot afford it, but thinking of health as a human right will change our mindset. And also many human rights folks are asking governments to do a health impact assessment of their policies and programs as well.
Calyn, another question?
think we have time maybe for one more. We're already at 10 o'clock, but let's quickly squeeze one more in. A question about how to reconcile communicating to individuals about climate change affects them personally is difficult. It seems that those with the most power do something about climate change are the least personally vulnerable. How do we reconcile that? Big question to end it, right?
Well, I
I'll
can
just-
address that. Oh, sorry, John, but like
No,
in
go.
this is what we exactly are doing right now in some communities in Wisconsin. What we need to do is actually go back to like the research engaged mechanism and have very strong community participation in deciding how to move forward. And to do that is really making an effort that go into all the neighborhoods and so on. And this is true, you know, usually if you just use public meetings and so on, you're going to have only those that are already concerned and so on, that do not represent the people on the ground. So yes, we are actually using very serious community participation mechanism to hear, you know, the voices of everyone, because it can really backfire, as the audience member said.
And I'll just add to that great answer that we need it at all levels, of course, the individuals to be acting, but individuals, it can't be, it's got to be a system-wide change, and individuals need to lobby for system-wide change. Otherwise, you know, we'll feel guilty as individuals, and that's not the way to go. It has to be big changes, transformational change at the system level.
Okay, I would like to bring this to a close because our time is up, but I want to express sincere thanks to Professor Jonathan Patz, Professor Sumudu Atapattu, and Professor Dominique Brossard. It was a really rich and productive discussion. I think everybody who stayed online learned a lot, and I really commend you all for your deep expertise that you were able to impart to us today. With that, I'd like to turn it over to Calyn. Thank you.
Wonderful. And thank you, John, for moderating today's really engaging discussion. I'm sorry we don't have more time, but everyone, please join me in thanking our panelists for sharing their invaluable insights and their hopeful perspectives today. I'd also like to thank all of you for joining and sharing your wonderful comments to make today's discussion so engaging. Our Global Health Tuesday webinar series will be taking a summer break. However, we will resume on September 24th, in which we will feature Harvard's Humanitarian Initiative to discuss their crisis training and preparedness programs. So be sure to check out our website, ghi.wisc.edu, to learn about our ongoing activities and find today's archived video. I hope everyone has a wonderful rest of your day and see you next time. Thank you.